Hey guys, good afternoon. It's Erica Hernandez, and I'm here with Dr. Harry Croft, and we're going to be talking about PTSD, post-traumatic stress disorder. It's something that affects millions of Americans.
Exactly.
Yeah, I mean, the latest stat we have here is about 8 million adults have PTSD during a given year, and you have a lot of kind of background in this. Talk a little bit about your experience with this so far.
Let me start off by thanking the viewers and thanking KSAT 12 for letting me do this. This is where I started my media career many years ago, and it's really an honor for me to be able to do this. I hope it's the first of many that we'll have talking about mental health issues, answering questions, and talking about issues. My background is that I came to San Antonio in 1973. That was right towards the end of Vietnam. I was in charge of the Army's drug and alcohol program at Fort Sam Houston. This was Nixon's showcase, and tragically, we never had an empty bed. As many people may know, there was a lot of substance abuse that went on in Vietnam. And in addition to the alcohol drug problems, the people I saw had something else. It didn't have a name in 1973. It's now called post-traumatic stress disorder, but it didn't get its formal name till 1980. But that's where my interest started. And I knew there was more to treating these poor souls than we were doing. I just didn't know what that was. But I became very interested in PTSD. 27 years ago, a company came to me that does evaluations for the VA and said, would you be interested in doing evaluations of veterans with PTSD? And I jumped at the opportunity. I've now seen over 8,000 veterans over those 27 years with PTSD and now TBI.
Now I want to get to some of the questions that we've already been that have been submitted. First one, how is PTSD diagnosed?
PTSD is diagnosed clinically. That is, we ask people questions, and depending on how they answer the question, we diagnose the condition. I wish sometimes we would have a blood test for it, or an x-ray, or an MRI. None of those things diagnose PTSD. So it is a clinical diagnosis, and we diagnose this based upon symptoms that come from several clusters.
And what are those symptoms?
So let me tell you the clusters first.
Okay.
So there are 4 clusters of symptoms that make up post-traumatic stress disorder. Let me start off by saying to have PTSD, you have to have a traumatic experience. And we can talk about what that is in a little bit. But it has to be a stressor that is very traumatic in your life. And it's something that you either see yourself, you witness it, or it's something that you see in others while it's happening to them. It's something that you learn about that might be happening to a family member or very close friend, a traumatic event, or if you're a first responder, it might be looking at reports and records day after day after day. So those are the stressors. The 4 clusters are these. The first is called unwanted recall. So these are unwanted things that pop in your head, and it could be thoughts, it could be nightmares, it could be flashbacks, or it could be triggering events. That's the first cluster, but they're unwanted thoughts that cause distress. The second cluster of symptoms is called conscious avoidance, and that means people go out of their way not to think about the trauma or to run into things like watch TV news and so forth that might remind them of the trauma. The third are negative thoughts and emotions, things like not wanting to socialize, feeling detached and estranged, not being able to fully experience positive emotions with your family, not trusting people, feeling guilty. And the 4th cluster of symptoms is called hyperarousal, and that means things like being jumpy at loud noises and people touching
during like 4th of July,
like
if you get the fireworks situation.
Absolutely. Or being hypervigilant, always looking. We've written a book on PTSD, and the name of our book is I Always Sit with My Back to the Wall. Because when I would ask veterans, you go to a restaurant, it's not crowded, this little sign says, sit wherever you want. Where do you sit? And the answer was always the same. I sit with my back to the wall where I can see the exit, because they're always looking around and always
trying to be making aware of whatever's around them.
Exactly. And then it may be difficulty with concentration and sleep.
So when somebody goes to the doctor or to get evaluated, how is that evaluation process? What are the indicators? What are the type of things that are done when you're actually in a doctor's office for this?
So if you're in an office and the thought is that you might have PTSD, they would start off asking you, have you experienced something in your life that was so traumatic that you have trouble even now, which might be years later, letting it go? So they're looking for stressors like I talked about. And then we'll get some information about what those stressors are. And then I would ask about the symptoms. What about these days? Do you have thoughts that pop into your head about that trauma that you have a hard time letting go, or that you don't want to be there in the first place, and that cause you a lot of distress? And then I'd ask you, how many people have you talked to about this stressor, and do you avoid things that you used to not avoid, like movies and TV news and stuff like that? And then I'd ask you about those negative symptoms, and then I'd ask you about the hyperarousal symptoms. And then you have to have a certain number of symptoms in each of those clusters, and if you do, we make that diagnosis.
One question that I saw that was really interesting from a viewer was, does PTSD stay with you for the rest of your life if it goes untreated?
So, with regard, let me back up.
Okay.
PTSD doesn't have to come from combat.
Okay.
PTSD could come from rape or assault or a hurricane or an auto accident or a fire.
Variety of different.
Generally, those things are called one incident caused PTSD. And there may be a difference between one incident caused PTSD and combat related PTSD, because combat related PTSD can be from stressors that occur day after month, even after years. And sometimes those are different. With regard to combat PTSD, the tragic answer is that if you don't do anything about it, chances are it doesn't go away by itself over time. How do we know that? Think about Vietnam vets. When I first started doing my work, all the people I evaluated were Vietnam vets. By that, even in those days, Vietnam had been over 20 years. Now it's been over 50 years. And if you know anybody with PTSD, you'll know their symptoms are not gone even 50 years later. Now, with treatment, people can improve and can begin to live lives that are very productive and very satisfying.
Let's talk a little more about veterans, first responders. You just talked about PTSD for different scenarios. What is the type of, effects a veteran or a first responder may see from something that they're dealing with every day or had dealt with every day for a while?
Most all of us, and studies show that most everybody, not everybody, has had a traumatic event happen to them in their life. That doesn't mean that everybody who experiences a traumatic event suffers from PTSD. If you've had an extremely traumatic event, over the first few weeks, you're likely to have nightmares, and you're likely to be withdrawn, and you may cry, and you may jump, and you may be withdrawn. That's called post-traumatic stress. That's an acute stress disorder. When it becomes post-traumatic stress disorder is when it's gone on for at least a month or longer, sometimes years and years. And that then is the PTSD we think about for most people.
That may be new to some people, not knowing that there is that difference between.
Yeah, you know, people think there's been a shooting at a school, there's been a terrible automobile accident. People may have difficulty with sleep, with eating, with crying, with thoughts, with nightmares, all that, but generally those will go away. And usually the statistic that's given, at least for combat vets, is only about 10 to 20% will suffer from actual PTSD.
Some of the other questions, I mean, people have asked about specific scenarios like sexual abuse and dealing with sickness. What about death of the family? Is that something that could cause?
Let me divide that answer into two parts. One part is symptoms that are. The other is a scientific or a medical diagnosis.
Okay.
So technically, the death of a family member, maybe a very beloved family member, that's not a particularly traumatic death. They died of some illness, they died in their sleep, it wasn't that they were murdered or in an accident or
natural
something.
Causes.
That generally does not qualify for producing PTSD. PTSD is when the death or the experience is particularly traumatic and that it's witnessed. By the way, watching something on TV is not generally considered a cause of PTSD. Now, if you have PTSD and you see something on TV that reminds you of what you went through, that could be a cause of PTSD.
Another question that we actually got just today, can divorce bring on PTSD?
Again, yes and no. I mean, the yes, for realistic purposes and for treatment, it probably doesn't matter all that much. But in terms of medical diagnoses, generally we don't think of divorce as causing PTSD unless there was abuse in the relationship before, unless the divorce itself was terribly traumatic, then it can produce PTSD, but it can also produce an anxiety disorder that's not diagnosed as PTSD, but can be just as impairing.
I want to talk a little more now about child trauma. Child Protective Services in the U.S. get around 3 million reports each year dealing with PTSD. Of the reported cases, there's proof of abuse in about 30%. Seeing it in kids, is that becoming more common?
I don't know the answer to that, because in days gone by, it wasn't talked about. So nobody talked about Uncle so-and-so or Grandpa so-and-so or Grandma so-and-so doing these things. Those things were not talked about. Does that mean they weren't there? Of course not.
Yeah.
They probably were always there, but they weren't talked about as much. Nowadays, we talk about those things more. We're exposed to them in movies and TV and other things. And so, because of that, it may be that more people are reporting it these days. But childhood sexual trauma, abuse in childhood, neglect in childhood, all those things can cause post-traumatic like symptoms. And in children, Erica, it's different. I mean, children, especially younger children, may not have the verbal skills of adults. So they don't tell you, I'm feeling nervous and anxious. They may act out. They may act out on the playground. They may start wetting the bed when they haven't been doing that for years. They may be withdrawing. They may not be eating. They may start to rebel against others. And so
you'll see behavioral issues.
Those are behavioral things, and if you're not looking for them, you may treat them as just bad acting, you know? So the kid that acts up on the playground, it's towards other children, may be seen as just, he's got a personality problem, he's got a difficulty relating to others. Sometimes when they get into treatment and the therapist starts uncovering stuff, they find out that what happened was they were actually sexually molested or they were abused in some other way. They just didn't know to talk about it, or they didn't talk about it. So it's important that people have the idea that this could have happened, and we know now that abuse, especially sexual abuse, is independent of a person's socioeconomic level or the color of their skin or their education. It can happen in the best and the worst of families, so you have to have it in your mind as a possibility, or you don't even think about it.
So for a child, is the treatment and different for a child than it would be for an adult?
It's the kinds of therapies that are used for children, and by the way, the treatment for PTSD, the most effective treatment is not medication, it's psychotherapy or talking therapy. And the kind of therapy that's used for adults and kids, called cognitive behavioral therapy, is the same, but it's applied differently because of the verbal skills and other behavioral things occurring in kids. But the therapy involves a trained therapist who knows how to work with kids, who knows play therapy as well as talk therapy, and who's got the background and the capability to stick it out with these kids, because sometimes it takes a while for kids.
Exactly. I'm glad you mentioned about the whole medication thing, because one of the questions we did get asked is, can you treat PTSD without medications, and do you have some tips, which you kind of just covered right now?
Yeah, and by the way, if it is combat related, my recommendation is go to the PTSD Center for the VA, ptsd.va.gov, and on there you'll find stuff for sufferers, you'll find stuff for family members, you'll find stuff for professionals, and there's a lot of great information. They have videos, they have a lot of things that can really help folks understand what needs to be done with their treatment. And let me mention here, because when I see my veterans, there's a lot of misconception. Let's say I have a sore throat and I go to my doctor and my doctor says, "Woo, you got a bad sore throat. You got a strep throat. Here's what we're gonna do. I'm gonna give you these pills. You take these 3 times a day. You take them for a whole week and you're gonna get well." Now, what if I don't like the doctor so much? Well, it really doesn't matter. Because if he prescribes or she prescribes the right medication and I take it and I'm not allergic to it,
you're gonna get better.
It's gonna work.
Yeah.
But with regard to PTSD, if you don't like or trust the therapist you're seeing, you may not participate. And one of the things we know is, if somebody with PTSD goes for treatment and doesn't fully buy in to the need for treatment and the treatment that's being offered, chances are it's not going to do very much. And so the evidence, the research shows it's the therapy, the talking therapy, rather than the medication. In some instances, medicines can help certain symptoms that get in the way of the therapy. For example, we have medications that help people sleep better. Mm-hmm. We have medicines that help with nightmares. Mm-hmm. We have medicines that might help with anxiety or depression. But those are symptomatic treatments, not full treatments. So it's like if I went to my doctor and I have a bad cough, and I'm coughing up ugly stuff, and I've got muscle aches, and I've got 103 fever, I go to the doctor, and the doctor says, well, you got pneumonia. Okay, so what are we going to do about it? Well, we're going to give you cough syrup for your cough. We're going to give you that nose spray to open your nose so you can breathe better. We'll give you muscle relaxants so those achy muscles won't hurt so much. We'll give you Tylenol for your fever. And you look at the doctor and you say, now wait a minute, don't I need an antibiotic? Well, the problem is we don't yet have the antibiotic equivalent for PTSD. So what we often do is give symptomatic treatment. Sometimes they're helpful, sometimes they're not.
Does it, I mean, when you say sometimes they're not, I've done or heard of stories and done stories in the past where some are just being prescribed too many medications. Is that a hindering?
Can, certainly can. And if the patient does not believe in the concept that they even have PTSD. I don't have that.
Yeah.
They don't even buy into that. They don't buy into the treatment that's being offered them. Chances are they're going to find every side effect will show up.
Exactly.
And it's not going to help very much. And let me mention this. In terms of getting better from therapy for PTSD, it doesn't work like this. It's not that you get better, 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 better in a straight line.
Yeah.
No, people get better. They kind of level off. They kind of backslide a little bit. They go back into therapy. They get better some more. They level off. So it may take 2 or 3 rounds
it's a process.
Of treatment before they get well. But let me say this, I have seen people over my many years actually get well and actually help others.
I was staying on the topic of treatment. I wanted to talk a little bit about the use of CBD and medical marijuana. Are you seeing more people with PTSD use these type of treatments, and does it work? Is it working?
So there are a couple of things.
Okay.
Some things make you feel better in the long run, but don't necessarily help, I mean short run, but don't necessarily help in the long run. Mm-hmm. Okay? So smoking marijuana may make people feel less anxious. Mm-hmm. Well, that's good in the short run. But in the long run, it may help them not to participate fully in therapy. Or it may remove their avoidance symptoms. Remember I talked about avoidance? Well, if it removes their avoidance symptoms, they may not feel the need to do the therapy, which in the long run is going to make them better. There is some research that shows that CBD oil may help for some people with certain symptoms, but the research isn't fully in yet. In medicine, we talk about evidence-based research, and it's important to understand alcohol would probably help make people feel better, but it's probably not going to do very much for their PTSD in the long run. And so just because you feel better in the short run doesn't mean you're getting better. And so we don't have all the evidence yet about the role of marijuana, the role of CBD. They're actually studying other things that the audience may know about. They're studying magic mushrooms, psilocybin, to see if that might aid with therapy. They're studying LSD to see if that might help open people up so they can do more in therapy. But the answers to those things are not yet in. There's research showing that ketamine might help some people with PTSD, but the long-term research, that's what we as physicians and mental health professionals look at. The long-term doesn't show that those are effective treatments yet. Maybe in the future they will be.
Well, it's a conversation that we're going to continue to have here. Is there anything else you'd like to add before we kind of close this out about this topic?
If I have, I teach all over the country.
Okay.
I teach physicians. And when I teach them, I conclude with what you have has a name. And I'd like to share that with this audience.
Okay.
And that name is post-traumatic stress disorder. And that comes as a result of your having experienced a very traumatic, maybe even a life-threatening situation in your life. It doesn't necessarily come because you have a personality flaw or you're weak of will and you just can't help yourself. It doesn't come from that. But you can improve by going to some treater who knows what they're doing, who you trust and will listen to, and actively participating in therapy. I hope maybe we'll have other web conferences like this. There were so many questions.
There were so many questions.
I was surprised how many came so quickly, and there certainly were enough to have several more of these.
Exactly. So I want to thank you for joining us here today. And if you missed it or joined us partially way through, you could always go back and see it on ksat.com. Thank you for joining us.